Why, liver attack does not exist. Our health advice, medical textbooks do not mention this popular term, only used in frank. Stomach aches, nausea, acid reflux, bloating. With their string of hearty and well-watered meals, interspersed with chocolates and other sweets, the end-of-year celebrations can sometimes turn into a nightmare. Who has never been the victim of the famous and quat, liver attack and quat? However, medical textbooks do not mention this term which, moreover, seems to be used only in frank. And for good reason. The liver is in no way involved in these symptoms, which are generally the manifestation of indigestion. And quat, what everyone takes for liver problems are, in general, only temporary imbalances in digestion, due to various dietary excesses and quat, explains Professor Didier Samuel, head of the hepatology unit at the Paul Brousse Hospital, Villejuif, and author of The Liver Crisis Does Not Exist. Marabout Editions, 2017. And quat, it and #x27. Essay bit like when you say and #x27. My heart hurts and #x27. To say that you are nauseous. In reality, the heart is not the seat of pain and quat. What are the symptoms? Normally, during a reasonable meal, the stomach and intestines constantly communicate with the brain to keep it informed of their level of fill-in. Quickly, it will send signals of satiety. But following an overly copious meal, the system gets carried away. Food accumulates in the stomach. This is called gastric embarrassment. Downstream, the intestines struggle to keep you. In addition to bloating and abdominal pain, and quat, the brain will send warning signals which will, for example, result in nausea and quat, says Professor Samuel. The liver is somewhat the hero of the story. It is he who is responsible for purifying toxins, regulating, partly, blood sugar and storing excess Fa. Of course, during the holidays, this metabolic factory is running at full speed. If these excesses remain very punctual, the liver is not impacted, however underlines the hepatology. But when large meals are repeated too frequently, he ends up accumulating Fa. A situation which, in the long term, risks causing hepatic steatosis, or so-called fatty liver disease, which can in turn evolve into cirrhosis, or even in extreme cases, cancer. And quat, it and #x27. Essay process that takes place over years, not in 15 days in quat, specifies the doctor. How to get over the symptoms? As you have understood, a small occasional excess therefore does not pose a problem for the liver. And quat. When this happens, you just have to eat less calories in the days that follow, drink only water, because alcohol also damages the liver, and do some physical exercise, and quat, advises Professor Samuel. In The Liver Crisis Does Not Exist, the doctor warns against so-called detox cures supposed to purify this organ. Lemon juice, artichokes, fasting. None of this has proven to be effective. There is no point responding to excesses with X's. On the other hand, taking a cure can help people pay more attention to what they eat.